Well, if I retain your ACL, your PCL, the outside part of your knee, your kneecap, I've retained all this normal tissue. So obviously, intuitively, that knee is going to feel more normal than if I took it all away and gave you a total knee. So your next question is, well, what about the outside of the knee? Am I going to develop arthritis there? Well, I'm going to answer the question. I hope you live long enough for that, because this device is going to give you probably 15 years of service. It's going to feel more normal. Your range of motion is going to be better. If you come to me with 120 degrees a range of motion and just inner side pain, I know that I can restore you back to your normal alignment by replacing that cushion on the medial side, inner side of your knee, and give you a knee that functions a lot more normal than a total knee. I'm not saying a total knee is a bad operation, because there are times when all three compartments are involved, or at least two of those three compartments are involved, and you'll need a total knee. Replacing the kneecap area is another great operation. That way you don't violate the ACL, the PCL, anything between the femur bone and the tibia, the leg bone. You leave all that normal tissue behind. You leave the meniscus, those cartilages in your knee, and you just replace the worn out kneecap and the anterior, the front part of the knee. The best one of these partial knees is the lateral side. Not as many that we see, but those patients are so happy when you replace that and get that knee again lined up normally.